And when the chi is a deficiency, there are the three types of the deficiency. One to be known as a deficiency means is the low or less, mild to moderate energy is deficiency. When we understand about the chi is sinking, sinking is indicating further deficiency to be known as a sinking. For instance, the patient having the 50% of the chi deficiency, that to be known as a deficiency, the chi sinking, that means again it is 75% of the disease is sinking, or the maximum is the severity of the chi is deficiency within the body system. When the chi is collapse, that indicating the chi is totally drained out. For instance, the chi to be known as a zhang chi or the chi to be known as a yin chi, that means is the yin or fu, any kind of the chi can be possible or there to minimize the chi. In that condition, chi is deficiency or the chi is sinking, 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 or the chi get collapses.
Deficient, the whole body will be deficient, or some organs will be.
Any particular, please note down your questions, and when I'll give the time, that time you just ask me. I respect all your questions, would like to give you the answers. By the way, please in between don't interrupt until we try to give flow in one direction. The second to be known as a collapse indicating, of course, is the yang is totally deficiency or yin is totally deficiency, but cannot be considered as a total deficiency, is indicating is to be known as a death. When the chi to be consideration is hyper or the hypo or the collapse, indicating that is the person is the last determination of the life. Then we understand about the chi is deficiency in how to analyze with the patients. If the patient is coming to you, I'll give you certain examples that will be really helpful in order to feel the chi is deficiency or excess. Now, when the patient is coming for the abdominal pain, so stomach pain is there, that time we try to find out by using the numerous modalities. By the way, when the patient is coming, that time itself you can judge and guess that the patient having the chi deficiency or excessiveness. When the patient is coming smoothly and easily, is coming to our chamber, is explaining that I do have the pain, indicating that the chi is deficiency, not the excessiveness. When the patient comes like a, oh, it is a very pathetic situation, I do have the very bad pain, so I am really feeling very pathetic situation or miserable, or it is really causing more acute pain, indicating that is the chi is excessiveness, right? Or else you wanted to know, when the patient is coming for the abdominal pain, try to feel it, palpate it. You just palpate means you are placing the hand. Then the placing the hand, patient says, I don't have the pain. Then you just go further deep. Then the patient says, mild pain is there. Again you go further deep. The patient says, yes, I do have the pain, indicating the chi is deficiency. Any kind of the pain, that's called as a chronic pain, to be known as the chi deficiency. Chronic pain, or the patient is suffering for the last couple of years, so that particular time is having the problem, is he can manage, but he do have the pain. I have the doctor, dull pain is there or a sweet pain is there, indicating that excessive is not there, but deficiency, which leads to the problem. But deficiency also indicating that belongs to the yin, that's not the yang most of the times. So therefore, we analyze that when the patient is coming for us for the again abdominal pain, when you place your fingers, you place your hand, then patient says, ouch, I have the pain. Please don't touch, doctor, I do have the severe pain. Please don't touch on that particular spot. indicating that is the excessive energy or excessive accumulation of that particular region where the energy is dominating. Chi is dominating. Drying out the energy, that to be known as the excess energy, and then solution for the deficiency to provide the energy to that particular organ. Sir, how do we do that? Here in the candidates who came here in the first time, that it will take some time to understand what I am giving you now concept, but however around 30 to 50% you understand, that would be really awesome, but that much you can understand. Now I am telling you some of the points which will be useful for the treatment therapeutic level, so that to be known as a chi is deficiency. Then you just provide the energy to that particular organ to be known as a, please let me know, abdominal pain itself. So which part of the abdomen having the pain, that also crucial, that also very important. So which part of the abdomen having the pain? If the patient is complaining, I do have the pain on the abdominal region. For example, the abdomen is divided into many segments. How many segments? This is the epigastric segment, right hypochondriac region, left hypochondriac region, right lumbar region, central region, left lumbar region, then the right inguinal region. This is the hypogastric region. This is the left inguinal region. So therefore, which part do you have the pain? It's very imperative. So now the patient is complaining, I do have the pain on the epigastric region, is indicating something is different. Patient is complaining, I do have the pain on the lower abdomen, is indicating is the different. But however, the chi and then excess or deficiency we are talking, that particular time you just place the fingers on the abdominal region, you just place it on the right side, the patient feel I do have the pain on the right hypochondriac region, indicating that liver energy is excessiveness which leads to the problem. If you touches, the patient feels the pain. If the patient is not complaining, then you are giving the pressure where the liver is located inside the intercostal ribs. The liver is located. Then you are giving the pressure deeper level. I do have the pain, indicating the chi is deficiency. When you place the hand and then patient says I do have the pain, that indicating is the excessive energy. The patient doesn't allow you to touch on that particular region is excess energy. So likewise, if the patient is complaining I do have the pain on the epigastric region, this could be reason is numerous reason to cause here. However, the epigastric region below the xiphisternum, patient is complaining, that indicating of course is the stomach related problem or the cardiac related problem where the food pipe to be known as the esophagus having the problem, or there is the hiatus hernia related conditions that also causes the pain on this specific region, and also the GERD, esophageal reflux disease. So that also reason to cause the pain. At the same time, on the navel region, the patient is complaining the pain. He touches, he have the pain, that indicating perhaps is maybe there is a intestinal related problem. If there is a deep pain is there, that indicating the worms infestation. Either it is the round worms, pin worms, hook worms, tapeworms, any kind of the worms which leads to the pain. Or the patient is feeling I do have the pain on the lower abdominal region, that indicating the pelvic organs where the gonads having the problem, which leads to the male gonads, that means is the testis or the female ovaries having the problem, that leads to the pain on the lower abdomen. If there is the pain on the right iliac fossa, RIF, having the pain on this region, of course indicating there is the appendicitis is the problem. Then the patient having the pain on the left side, on the left iliac fossa or the right iliac fossa, hernia also reason to cause as a inguinal hernia, causes the pain. But wherever you wanted to place, you are placing that on the hand, that indicating I do have the pain. So what? How do I understand? How do you understand, all of you? Chi deficiency, chi excessiveness. Please register in your mind forever. Chi deficiency you cannot analyze super simple way. However, I am giving you the key information. So always whenever for the diagnostic purpose is required, instantly you can diagnose that this is the deficiency, this is the excessiveness which leads to the problem. Then you understand the chi is deficiency and also the blood is deficiency, su is deficiency, essence is deficiency. Also more or less is same kind of the phenomena. Patient feel that kind of the sensation. Remember, anything the pain related condition, in the overall general information you wanted to know, any pain is existing within them, that indicating there is the liver, blood means is the stasis means is the congealed means is blockage means is stenosis or the occlusion. Anywhere this kind of the problem causes which leads to the pain, stiffness, spasticity, rigidity, which leads to this problem. When the patient is finding that I do have the chi is deficiency or the su means is the blood is deficiency, both the conditions you try to understand, it is connected to the deficiency. That particular time we need to strengthen the energy to that particular viscera. Viscera means organs, viscous means organ, there is a plural, viscera. Viscera means internal organs. Viscus, viscous means is the singular, plural is viscera, singular is viscous. Orb means singular organ, orbs means orbs means internal organs. So therefore, wherever it is possibilities are there which leads to the problem of the pain condition or the cramps condition, we try to understand. Now the providing the energy to that chi deficiency, that time always you remember there are the 2 points you can register in your mind, that to be known as is the parental points or the mother points, or to be known as a tonification point, reinforcing point, stabilizing point, to be called as enhancing the chi to that particular organ. For instance, the abdominal pain, the patient is coming to you, so that time is the very dull pain is there. On that situation, which point to be activated? If the stomach pain, if the patient is complaining, I do have the very dull pain, doctor, in this region, that indicating, of course, there are the 2 ways I am teaching you. One way to be known as a pulse diagnosis, or that particular time no other diagnosis perhaps is required according to my clinical experience. Whenever the pulse diagnosis gives the dilemma, ambiguity, that time certainly we can add up that another modality, this palpation, interrogation, then talking, inference diagnosis, touching diagnosis, right? So that time you just add up the point to be known as a chick-see. If the patient is complaining, I do have the pain, then add up the chick-see, that is stomach 41 is the mother point of the stomach, you can add up. When the patient is complaining, doctor, please don't touch for me, I do have the very, very bad pain, on that situation, what to be done? It is the excessive energy of that particular organ. What to be done? Drain out the energy, scatter the energy, disperse the energy, deplete the energy. That to be known as a lidui to be known as a stomach 45. Stomach 45 is the sun point, stomach 41 is the point to be known as a mother point. So which point to be activated? You can accordingly, you can add up that. When you are using as a single point, when you are using the few clinical points and the local points, so that time remember to add up the one particular point to be known as a command point. The another point you wanted to add up as a local point, certainly you can use one local point, that to be known as a locus dolanti. Locus, L-O-C-U-S, locus dolanti, D-O-L-A-N-T-I, dolanti. Locus dolanti to be known as that particular tenderness point. tender points known as a locus dolanti, or you wanted to keep it in the mind, you just forget about it. When the patient is complaining, I do have the pain on the specific region, add up one local point on the specific region, this point to be known as a clinical acupuncture, the stomach 45 to be known as a classical. If you wanted to add up together, that have the synergy effect, that having the added effect, so the patient feels mentally satisfied that I do have the pain, doctor is inserted the needle on the specific affected area itself to get the relief of the pain. How the patient will take up in that level. But however, you just add up these 2 points will be very good. But at the same time, whenever the excess energy is there, remember again, but you shouldn't apply the needle to the deeper level. Make sure already there is a inflammation, already there is some kind of the infection on that particular region. The patient is pathetic situation. That time you are inserting to the deeper level. Again, it causes the viscera get damaged, viscous get damaged. Chances are there. Again, the patient is coming to you that I do have the pain on my abdominal region. Doctor, please you just look into that. Yes, professor said me it is the excessive energy it causing the problem. Then you are depleting the energy to be known as a Shangyang, Erjian, Sanjian, Li1, Li2, Li3. These are the points you have depleted the energy. That energy, of course, you are depleted. But the problem is in the colon where the vermiform appendix is there. That time you are handling and treating without doing any ultrasound scan. It's not so good. When the patient is coming, is emergency case is there. Otherwise, chances are there vermiform appendix will going to burst, and then that will scatter the inside energy, that causing the toxicity inside the abdominal cavity or the perineal cavity. So that causes the multiple problem if you are not recommended and suggested to the right doctor on the right time. If you have taken 1 to 2 hours, 3 hours extra for them, then which leads to the major complication. You could have saved the patient if you have sent to the hospital in emergency. In that case, so many concepts are there, but what is required for us, we need to be very clarity before stepping into the treatment. Where is it emergency? Where is an unemergency? Sometimes you try to understand. If you are in dilemma, that time you just put a word, I am doing the best of the best treatment today. Somewhere you just note down. Remember, somewhere you just note down in their prescription, in their personal card, in their acupuncture record, in their anywhere, whatever you are giving some kind of the acknowledgement to them, there you just mention immediately or advisable to see the laparoscopic surgeon, to see the surgeon, to see the physician, to see somewhere else who is the specialist for them. Pulmonary problem, you recommend pulmonologist. If the cardiac problem, you suggest the cardiologist. On the writing, on the paper, you just put it one word to them. If that goes to the court, then the court will give the evidence that paper, yes, you have already recommended to go to that doctor as well. But you have done the first aid treatment. FA, remember, first aid is the very, very important. Anybody can be given any for the emergency purpose to save the life. So therefore, nothing to worry about it, but you have given advise them to do that. But however, the patient is coming for the dull pain. Dull pain is coming for the last couple of months. That time there is no emergency. Ultrasound scan is saying that there is no abdominal much problem. There is some mesenteric artery having some problem, or there is some kind of the PCOS or PCOD having the problem, right? Or there is something connected to the gallbladder, 1 mm, 2 mm stones are there, or there is the stones in the renal kidney system, that is 1 mm, 2 mm, 3 mm, up to 8 mm. Certainly we can handle the treatment by using the acupuncture alone. That slowly will come out. Anything accumulated, anything is excessive which is accumulated, that indicating when the energy of that particular organ get excessiveness, which leads to that problem, stepping into that the renal stones are there. That time renal stones are not the problem of the chi deficiency in the kidneys which causes the problem. Remember, this is the excessive energy of the renal system which leads to the accumulation of the stones. At the same time, the gallbladder, I think some Sharanya is there, I believe, I don't know, I'm not very sure. She is asking about the gallstones. But here is excessive energy of the gallbladder. So that time which leads to the gallstones as well. So therefore, to detoxify that particular organ by using the 2 points to be known as a sun point and grandson point, you detoxify that to be known as a yang fu, the other point to be known as a yang ling chuan. Yang fu is the GB38 and yang ling chuan is GB34. Both the points are depletion point. You detoxify that, but a specific point for the gallstone, one point is there, one particular region, that point to be known as a than. Than means is Chinese terminology is gallbladder. Than nang, the specific point for the gallbladder stones. The patient is feeling that I do have the pain on my right side of the abdomen. We don't know it is the fatty liver is causing the problem, or the liver cirrhosis is the causing the problem, or the peritoneal cavity fluid accumulation is causing the pain, or the intercostalis muscles are causing the pain. But try to and gallbladder stones are causing the pain. That time you just try to find out one, where is the nang point? Anyone can you please tell me? So 1 chun distal to the GB34. Around, there is no one specific point, but that point to be known as a area. That area to be known as a 1 to 1.5 chun distal. Distal means below to the GB34. That area to be known as a tan nang. So therefore, that area you just treat activating that point, or you give the pressure on the specific region to find out the problem is in the abdominal problem, or the problem is related to the gallbladder stones causing the problem. Then you analyze and understand. In the same way, when the patient is complaining on the right side, patient told me I do have the pain. At the same time, patient is telling I have the pain on the right iliac fossa. So that time you just analyze, mention where exactly the point is located. That's called as a, where is the vermiform appendix point? Where that point is located? Come on.
Where the small intestine enters the large intestine.
Come on, 1 second, please.
Where the small intestine enters the large intestine.
Oh, that's good. I'm asking about the point where exactly there is a specific point to treat for the vermiform appendix.
Extra 30.
Wonderful, wonderful. Extra 30.
33.
Good, 33. That's called as a LAN. LAN means is the appendix. Wei means is the stomach. LAN Wei point is located 2 chun distal to the stomach 36. 3 chun distal to the stomach 36. Which point? Shang Juksu. Shang means is intestine. So that point is located. So therefore that area, no specific point. Below the stomach 36 region, 1 finger breadth lateral to the anterior border of the tibia, you can find the pain. So this entire area, मैं नहीं देख रहा ना बाबा इसमें आ जाओ कुछ. This is the entire area to be known as a, the stomach and then intestine region. Stomach and intestine region to be known as a, this particular area. Right? So therefore, in 1972, Richard Nixon, from the Vice President of America, who visited to the China, he attended the medical conference of the TCM. Then that time he aggravated the pain on the right iliac fossa. So that time the Chinese doctors has given the treatment for that particular condition. Then again he's gone back to their respective country. Then immediately in 1972 onwards, in Central America has been recognized. This acupuncture is the system of the medicine. That is officially, there is the councils and accreditations and also commissions are existing. Do you know NCCAOM, National Certification Commission for Acupuncture and Oriental Medicine, National Accreditation Council for Acupuncture and Oriental Medicine, Royal College of the Moxibustion and Oriental Medicine is existing in the America under the NIH, National Institute of the Health. So, however, what I mean to say, if there is the super specialization doctors where there is the group of the doctors, they were treated successfully. You complaining, I do have the shoulder pain. Thank you. But shoulder pain is indicating I do have the very dull pain, indicating the chi is deficiency. When the patient is, I couldn't take doctor, it is very, very pathetic pain, indicating excessive energy. When the excess energy is there, drain out the energy. When there is the dull pain, that's called as a sweet pain. Pain also bitter pain, sweet pain. So pain, did you feel that is sweet pain anytime? How many of them believes that is sweet pain and bitter pain? How many of them you feel that is sweet pain, right? So where do you have, did you get a sweet pain before? Cervical pain, a very sweet pain. हाँ अच्छा लग रहा है, मजा आ रहा है मुझे. हाँ अभी ठीक लग रहा है. You feel in that way, but however, however pain is unpleasantable phenomena. But I do believe that. But however, whether it is the very dull pain, I do have the pain for the last 5 years, the patient is complaining, that indicating, but he does the work, day-to-day activities he is doing, but at the same time pain also existing. Patient is coming, most probably you knows that, sir, I have the 7 years pain, 10 years pain, for the last 20 years I am suffering for this headache, doctor. If they says like that, but they do have the pain, that is the chi deficiency. Perhaps the chi stagnation also. Chi stagnation or chi congeals. Congeals means is the blockage. So anyway, these conditions indicating that time it's essential to regulate by activating the 2 points you remember in your mind. That point to be known as a mother point, the another mother point to be activation, the second point to be known as a grandmother point is a sedation to be taken place. Sir, grandmother means is tonification. Why you should say as a sedation? But that is again, it is the supreme level understanding again. But however, you just register in your mind 1 point to be known as a mother point. If the lung having the deficiency, Thai Yuan LU9 activate, and also you wanted to sedate the UG, that is LU10 is advisable. When the most of the times headache, people are suffering, very bad pain is there, very acute pain is started right now, need to deplete that, indicating excessive energy. Sedate the gallbladder energy by using this to Lin Chi, that is the Su Lin Chi GB41. Sedation is good. When you wanted to add up the another point to be known as a Yang Ling Chuan GB34, sedation is good, or you wanted to use as a Yang Fu GB38 is good. When the patient is complaining, I do have for the longer time I do dull pain is there, that time 2 points you remember in the mind, that point to be known as a Chuza, the second point to be known as a Chung Chung, that is Chuza, pericardium 3, Chung Chung, ZHONG and CHONG. That point to be known as a H9. Both the points you just activate, that means is the P3 is the sedation and then P9 is the tonification. If you are in dilemma, I don't know what is sedation and tonification, apply the needle randomly, those 2 points, that will be taking care of the body itself. But the chi is required, chi is not required. The body will understand what is required, whether I need to be tonified to this guy or I need to be deplete to this guy, whatever is, the meridian is selected. When you are selected the right location and right point and right indicating about that particular illness, that time the body cure on their own. Body will accept and auto adjust in our body system what is required for him, that will take care. But however, why I should say as a tonification sedation based on the perspective of the Professor Park Javo concept, that's called as a Korean philosophy. However, it's the good, you just accept it and take it to your mind. What's wrong in it? So hopefully, how many of them understand about the cheese deficiency, cheese excessiveness, or the cheese blockages or cheese gain? Or the chi or the su? You remember both are more or less the same to understand. When in the classical level to understand, then that time I'll talk in the different level. In the preliminary level, this much if you understand, that's quite enough.